Hi, everybody, and welcome to Right in Front of My Face, the podcast that talks about big things happening right in front of us. I'm your host, Shannon Hull, and I'm coming in hot with a bonus episode because I feel strongly that I need to contribute something in this pandemic. And what I feel like I can contribute is staying calm and finding facts. I put out a call on my Facebook page to ask if anyone knew an epidemiologist I could interview that might be able to shed some light on what we're seeing and hearing in the news in Seattle. Within minutes, a good friend of mine connected me with her neighbor, Dr. Alison Drake, a PhD epidemiologist at the UW School of Public Health. While she's not a coronavirus expert, she's an expert on the spread of disease, and man, does she know how to read a graph and explain it. It was honestly incredibly refreshing to hear a woman take me through some data. Clearly, we need some more female voices in leadership. But in all seriousness, I think my husband put it best when he said, I don't think I've ever said I don't know more times in my life than I have in the last 2 weeks. As grownups, we're really not accustomed to the answer eluding us than the future being unknown. This quarantine is a foreign land to all of us. I'm a true extrovert, meaning when I'm around people, it energizes me. To be isolated literally sucks my life force. And I'm struggling more this week than last week, being away from my tribe and my network. We are, all of us, desperate for an answer that no one has. When will schools open? When can I get back to work? Are my kids going to be okay? How do I talk to them about this? All these questions with no answer take a very real mental toll, and many I've talked to are feeling it psychologically. I have no answers, and actually neither does Alison. But what we do have is the ability to connect and learn. Alison generously answers all the questions as best she can. I hope you can take something of comfort away from this conversation. I am with Alison Drake, and Alison, your CV is long and fairly impressive. So would you mind telling our listeners a little bit about your education and your background and how you can be such a huge help to us with your insight in public health?
Sure. So I am an infectious disease epidemiology. I received my master's in public health from the University of Michigan in epidemiology, and then got a PhD here at the University of Washington. And I started my career working in public health departments, initially as an intern in Michigan, working on HIV and mother-to-child HIV transmission. And later, after graduating with my master's, at the Centers for Disease Control and Prevention, where I worked in their foodborne and diarrheal diseases branch and worked on outbreak investigations. I was there when the SARS epidemic hit and worked on some of the outbreak investigation work with that. And then moved to Seattle, working with Public Health Seattle and King County, again, working in infectious disease outbreaks, primarily foodborne diseases. And then started my PhD here and have been working on HIV and mother-to-child transmission. So I'm not a coronavirus expert. I'm not an expert in respiratory diseases, but I've really noticed that many of my colleagues who have had similar career trajectories have found themselves back to the roots of why we got into public health in the first place and have been following the epidemic as it has occurred and are really interested in trying to do what we can to help people understand what's going on and pitch in any way that we can.
Well, I really enjoy talking to really smart people. So again, thank you so much for agreeing to come on, never having met me, because I think the only thing that I have found that I can really do, aside from staying inside, is attempt to push out some real factual information and try to answer questions that I think a lot of people have, but maybe don't have the opportunity to ask. So Alison, thank you so much. So like I said, I am feeling like a kid trying to process big feelings right now. Can you kind of take us through the beginning of this and walk us through a timeline in the decision-making process of King County Public Health on why it kind of took us so long to get to shelter in place?
So I think that our epidemic started in this country in the United States in our King County area was faced with the challenge of really trying to understand some of the aspects of transmission generally, but also faced with something that no one really anticipated in any kind of pandemic was the inability to be able to do and ramp up testing within our communities. So the initial problems with the test kits that came from the Centers for Disease Control, the delay, the lack of ability to verify cases early on in the epidemic really hindered our initial public health efforts. Actually, after 9/11, there were a lot of efforts put into preparing for a potential pandemic or other national emergency of this type and scale. And if you go back to a lot of those materials, you'll see that testing was always identified as something that we would need, but almost no one ever predicted that that would actually be an area where we would struggle. We're in a difficult position to be able to operate without the absence of information with testing. So when that first cluster came out from the life care facility, those delays in being able to get people tested and the beginning of community-based transmission that was already happening were unexpected. And it's possible that what we're seeing now with more community-based spread is different than what they saw in China. And it's hard to know whether it's maybe due to a different strain of the virus, or if China's earlier efforts made their epidemic under control faster. So, once there was already community-based transmission and then later evidence that there could be more asymptomatic people without symptoms who were spreading the infection, that really changed the course of how we approached infectious disease control, because you can't just look at the cases, you have to start looking at, all of the contacts. So for the social distancing efforts that initially were started in California, I think most people were wondering why, when the epidemic was larger in scale, as far as number of cases in our own community, why we weren't the first ones to offer shelter in place or stay home, as Governor Inslee calls it. And I think from what I was reading between the lines, between Governor Inslee's initial press conference a few days before the stay-at-home measure was offered, and it was right around the time that California had issued theirs, is that they really wanted to be careful in thinking about who the essential personnel were, as well as, this is just speculation, but that the request to declare our state in a state of national emergency and request additional resources, that there could be things behind the scenes that perhaps made those things falling in place open up a floodgate of other resources or legal allowances that made the shelter in place or the stay home order more attractive to delay by a few days. That's complete speculation. I don't know that that's true. But I think that what I saw from Governor Inslee is that there was a very careful and calculated measure to be watching, one, what the voluntary efforts were. And I think to balance too, people's, individual rights and freedoms, and to take, what we have been recommended to do, take that into our own hands versus implementing legally binding order to prohibit activities. And so they were monitoring the traffic patterns. They were monitoring, the DOT was monitoring the flow of traffic around the city, and I'm sure other sources that they maybe didn't elaborate on, to see how well our social distancing measures were working. And unfortunately, as more things shut down, like you've heard perhaps about some of the parks that were open and then they found, thousands of people would converge, it was more difficult to keep things open because the remaining places where things were open, people would converge, and you don't know until you get there that location is going to be busy, and do you go home or do you stay, and lack of clarity on what to do.
That's absolutely happened to my family and I.
Yeah, it was a snowball effect. I took a break from the news for 18 hours, the first time in this whole epidemic I've done that. And I missed the order about, that the parks had closed. They hadn't gone around to the playgrounds, or at least I should say the playgrounds were closed. I didn't know that day. Obviously, other families didn't know either. They hadn't set up the caution tape yet around the playgrounds. And so we didn't know. We were at the playground. And I was really following the guidance. And I think there's been a struggle for families and individuals to think about, should we be more aggressive than what's recommended? Or do we follow our local guidance? And understanding what I knew about the epidemic, what I understand about transmission, I, just as everyone else, were making calculated decisions about what's safe and what's not safe, with the take-home message of, if no one is spreading droplets on you, which is the most common way of transmitting the virus, and if you can avoid touching your eyes, nose, and mouth, that actually you're safe from acquiring coronavirus. Actually, there was a great Daily Show where they talked about, they had Dr. Anthony Fauci from the National Institute of Allergy and Infectious Diseases, and he did a great job talking about, these practical measures of, really interpreting the guidance of what's really risky behavior. And other things I think that there's been more interest in thinking about, which is acquiring an infection from touching something, which there is a theoretical risk. Everyone says it's not the predominant way that the virus is transmitted. There is a theoretical risk, but we really don't know very much about aerosolization or, touching an object and then acquiring the infection later. And really, it's not possible if you wash your hands and don't touch your eyes, nose, or mouth afterwards.
Right.
So I think the community has heard more about like concerns about touching everything and fear of opening up, their Amazon boxes. But still, the guidance is that it's respiratory droplet transmission, and all the other ways that the virus can be acquired are really lower risk. And if you wash your hands, there shouldn't be any risk unless someone is coughing or sneezing on you. And thought it was great that Dr. Fauci, really said the same thing yesterday. So I felt confident in following that guidance and continuing to follow it.
I am happy to hear that. And there's been a viral video going around from a doctor in, I think, Massachusetts or Michigan, telling people how they need to disinfect all of their groceries before they come home. And that is not a part of any guidance I have personally seen. Is that something that we all need to start doing?
Again, every family will need to make their own decisions. And if that makes you feel more at ease or more comfortable, then it's certainly fine to do so. Some people say just leave it on your porch for a few hours, that, if you're really concerned about it. But really, again, if you wash your hands afterwards, then there isn't any risk. So if you want to, our family, when we come in from anywhere, when we unload anything, when we unpack our boxes, we just wash our hands everywhere and dispose of the boxes. It's really quite simple. But if you are very paranoid, and there is, we live in a state of fear. Many people are very fearful, especially as there's new projections about what this epidemic will look like in the next about 2 weeks for most states, that, our medical system will be overrun. We won't have enough hospital beds or ventilators. And for people who have underlying conditions who might or are, over 60, 65, 70, that they may be more fearful. And if for them it makes sense to literally not leave your home, not order anything from the internet, not open anything for a short period of time, if that gives them peace, then I say do what you need to, to make yourself, feel more comfortable with protecting yourself. But personally, I don't feel like those measures are necessary. It's just, again, that simple message of don't touch your eyes, nose, or mouth unless your hands are clean, and continually wash your hands.
It's so interesting. I feel like I've never been in a situation more where you just can't judge people for their reactions. It's like grief does all sorts of different things to people, but this does seem to be something where each family is going to make their own decisions, and we all as a collective have to be respectful of that. And I think that's wise advice.
And this will continue, when eventually we get to the lift on the social distancing measures, that people will follow their own comfort on what they're comfortable doing when, just like at the beginning when things were starting to shut down, what people were comfortable doing. And I think as long as we are within the realms of what our guidance is, we shouldn't blame or judge anyone who wants to take those more extreme measures if they choose to do so, with, I would say, the exception of buying N95 masks.
Right. Yes, correct.
Make sure that we have the resources we need for our medical healthcare workers. But if you are feeling more comfortable, when I saw that with my own community, there were some people who are more aggressive and basically were implementing, I'm not leaving my house from the first day that schools closed was about when it started. Prior students I've worked with had said the same thing, like they literally hadn't left their house in 4 to 5 days. And, this is at the beginning. This is about 3 weeks ago now, 2 to 3 weeks ago. And I don't think that's what the guidance is, but it is difficult to know, what's safe, what's not too safe. And you do need to kind of read between the lines a little bit of, is it safe to go outside? Everyone's saying, yes, it's safe. Maintain social distancing, which everyone is becoming an expert at. But there are times when it's difficult. You pass someone on the sidewalk, some people walk across the street to go to the other side. If you pass them for a moment, is that okay? I mean, I think the guidance is easier to just say everybody at all times keep 6 feet apart. But there are practical times, like in a grocery store aisle that isn't even 6 feet apart, that you don't even have that choice. So, I think we just have to have comfort that we're doing the best we can. It's imperfect, but these times when we have those passings, it's actually very low risk of transmission just by passing someone, quickly in an aisle. And again, if you're washing your hands and if you're staying home when you're sick, that those risks really are low.
Can you talk to me a little bit about, because you just said something that leads me to another question, when the restrictions are lifted, can you give me some visibility on how public health decides these dates that seem kind of magical at this point? May 18th for non-essential businesses to open. My husband had to shut down his practice along with every other dentist in the state. And, you look at that and then you look at the projections and it's hard to know why those dates are kind of being pulled out of thin air. Can you explain how they're linked to what public health is doing? Are they linked to incubation rates? Are they, I just am curious as to what informs these dates.
So first of all, I think most of the guidance, and the school closures is one good example where, our schools are closed in Seattle and our public school system until at least April 24th, and they haven't changed that yet because they knew it would take at least that long. I think people get fearful when they are projecting things out longer. So going with the minimum duration of closure at the beginning makes sense because why close for longer than you need? And we're in a very dynamic environment where things are changing constantly. And all of the projections and all of the models are based on assumptions of people's behaviors, on policies, on practices, and that we never know what tomorrow will bring until we reevaluate what we have now. One example of this would be in New York City, where they brought in, a huge ship to be a medical hospital, or in King County, where Harborview is converting some of their non-medical space to triage patients and put those who are either in isolation or don't have respiratory conditions into separate areas, or to build the field hospital in Shoreline, or now there's one proposed for CenturyLink. So these extra surge capacities will change the face of, how many hospital beds are available, when we are crossing thresholds. And with every piece of information, that will help inform when we are at capacity. But getting back to your question about the timeline, you want to project, when things are going to get better. And if everyone literally was able to just stay in their house, never leave for 2 weeks, that is the incubation period for infection. So if someone acquired an infection today, it could take up to 2 weeks for that infection to be detected and then treated, and for contacts to be traced to figure out who else might be exposed. But then for each one of those subsequent exposures, it will take another cycle. So some of the projections out to May 18th are really riding on what we have learned from China and South Korea, and from Italy about how well they have been able to or not been able to contain their own epidemics, and that timeline of just really getting closer to zero. So there are different ways of looking at this, flatten the curve, and there's no one specific metric. There are many metrics people are looking at. It's the absolute number of cases, the total number of new cases that are detected each day. But you can also change that to say, what's the daily change? What's the percentage change from one day to another? And you can use a logarithmic scale to look at that flattening of the curve. But you can also measure it by, the number of deaths over time and the positivity rates going down over time as we're able to increase testing. So our public health professionals who are, doing the COVID response are looking at all of those metrics to see, are we starting to flatten? But knowing that even if we start to flatten, it will still take, a few cycles to get to a place where we might be able to, release the floodgate again and resume normal life. But we don't know what that will look like yet. We don't know whether it's going to be everything is shut down to everything is opened, or that there could be some triaged approach to determining which activities we can resume, monitoring the data to see how well that's working. And there could be some blips over time of smaller epidemics, smaller outbreaks that we're able to contain. But no one really knows what this will look like yet. And most of the people in public health don't feel like now is the time to be thinking about that anytime soon, and that we are likely going to continue, these efforts for a few months, but exactly how long, it's almost not even worth projecting because the data is constantly changing. So we should just be looking at the data to guide us in these like dates, but there is no magic number. There's no magic date. They're projections that again will change.
So it seems to me, and you and I have talked about this, that there's a steady number of positive tests per total tests. How can we ever get an accurate read on mortality rates and on much of any of the data when we don't know how many people actually have it? Right? So it seems like we're seeing these cases because more cases are coming back positive, which seems to make sense when we're testing more people. But without a control group, it seems so difficult to actually interpret that data.
Yeah, this is one instance where we actually don't need a control group. The control is really looking over time. So you're looking to see what happened yesterday, what happened today, what happened tomorrow, and you're looking for trends. So when you can really ramp up testing, and I don't have a magic number of the number of tests per day, but as you do more testing, as we have higher testing coverage, what you would expect to find is that the number of positives among all of the people that are positive, that you want to see those numbers going down, because that means we're interrupting transmission. There aren't as many new cases occurring. Wide-scale testing still is not occurring. And, it's been one delay after another to really scale up. The King County numbers are great to look at. They do publish the number of tests that they are doing per day. And I think yesterday was the most tests they had done so far, with additional efforts that I have heard are coming next week with more testing efforts. Three more machines are coming in for some of the University of Washington laboratories. They pulled in resources and personnel, time, supplies to do testing, and that there are now 2 new FDA approved test kits that are for rapid use. One of them is a 15-minute test. The other one is a 45-minute test. And how quickly we can really scale up those efforts and get them into people who need testing to really understand how much we're able to get a hold of the epidemic is unclear. I mean, that has really been the call since the beginning of we need more tests to really understand. So it is hard to interpret, the data to know if we are starting to flatten. However, the number of new cases does appear that there may be like the beginning of flattening from, the last few days from what I've heard from, our own School of Public Health officials.
So is it true that the test results are taking 7 days to turn around?
It depends on where they're done. I think the public health lab from the state does take that long. I'm not sure about the turnaround time for the University of Washington. I think it might be shorter. And then obviously the ones that are just approved would be, real-time point of care. So part of that is that the tests that are currently approved, they sometimes need to be sent away to a different facility, especially the commercial labs. And so there's time to collect the sample, transport it, run the test. It might be batching tests, I don't know, and then to send it back.
So knowing that there's that turnaround time, are the numbers that King County Public Health is publishing each day, is that accurate, or are we looking at data from a week ago?
Well, you're always looking at the day of detection. No matter what disease you have, it's not the day that you acquired it. It's the day that you have that infection detected. And because you might be shedding virus for, 2 to 3 weeks, that if you are caught within that window, then you would show positive. But you don't know at what point that person acquired the infection other than following their symptoms. And then for asymptomatic cases, then you wouldn't know.
What is your take on a reasonable plan for coming out of isolation? Because you did say something earlier about, there probably will be rebounds of this. And it does seem like, okay, well, we've all been, sheltered in our houses. Then we all come out at whenever public health is telling us that it's safe. It does seem inevitable that there will be rebound of this. And is the shelter in place order dictated mainly by hospital capacity, which is what I heard. I heard you say something to that tone earlier. I just want to clarify.
Yeah. So the shelter in place or the stay at home messaging is predominantly to maximize our ability to provide medical support for those who get infected. Because if our healthcare systems are overstretched, then we'll end up being in a situation like Italy, which is really struggling right now. So that is the primary concern. And then the secondary concern, equally as important, is to start to reduce transmission. So together, those two things are the rationale for social distancing. At what level or what will trigger, the release, and what that release valve looks like, as far as, what types of activities will we be able to resume, and when. There are obviously a lot of debates about that. There are concerns about the economic impact, and no one wants to see, our economy shut down. No one wants to see us at home for long periods of time. Everyone is invested in getting us back to work. At the same time, we don't want to prematurely release that valve so that we're right back in the same place where we started from, and the epidemic continues to spread throughout our communities. It may be inevitable that this could just filter through our communities, and that it will just be over a longer period of time. That's kind of the flatten the curve messaging. It's also possible, I don't know how likely, that we might just be able to prevent future transmission. But in SARS, they also predicted that there would be a surge and that we would get a second wave, after the first initial wave of cases, and that didn't happen. So they are different viruses. This coronavirus is more contagious. It's not the same, but we don't know yet what this will look like as far as, having a second wave, and what those strategies will be to determine what and when we release. It's one of the hot topics right now.
Yeah, I think we're all looking at summer thinking, how are we all going to survive this? I mean, I think we're just learning so much as we go. The one good thing about this, though, as I have two kids, as do you, kids don't seem to be getting this at the severity that adults are. Can you speak to that a little bit?
Yeah, so if you look at the number of pediatric cases of children infected, it's quite small. And that I think even in King County, there's definitely no deaths among children, and even the upper age range. I think forgetting whether it's over 40 or maybe it's one person or a few under, between 20 and 40, but predominantly people who are young and healthy, do quite well. That the mortality, there's very low risk of mortality, and most of them are likely to be asymptomatic. We don't really know why that is true. There might be some biological differences with children and how the virus attaches to start replicating. We don't know why children are different. It's very unique. Most of the time when we think about who's most susceptible, it's the young and the old. And in this case, thankfully, our children are likely to do quite well if they were to acquire the infection. It's not a guarantee. There have been discussions on social media about these like coronavirus parties. This is something that stems from chickenpox, where people used to purposely infect
That is so funny.
their children.
I was just talking to my husband about that, and I said, I feel like you're just going to watch. People are going to start doing coronavirus parties just like we did with chickenpox. Is that really going to happen, do you think?
It already has happened. There's already been one, and someone has already, I don't know the outcome. I can't recall what that outcome was, but someone has already ended up having coronavirus as a result of a coronavirus party. So this is not something that we want to recommend.
Whoa.
It's interesting to think about how immunity might play a role. And as people become immune, which we don't know for sure, but we are anticipating based on what we know of other viruses, that there will be some immunity after you get infected, even if you're asymptomatic. So many of our children, many of us, could already have had the infection and been asymptomatic. Eventually, there could be antibody tests that would determine whether you had been infected at some point. And you don't know if you are contagious at that point unless it's been quite a while since you've been exposed, or if you had another test that was looking to actually measure virus. If you didn't have detectable virus and you had antibody, then you know that you had the infection, and presumably you might be able to filter back into the workforce and say, I have my proof that I have cleared the virus. That could be one strategy that's employed, but because those tests are not available yet, and we're already struggling with testing capacity for those who need it most, I don't know when or if that would ever factor into our containment efforts and kind of resuming normal life as we know it, but it's possible.
Because that, to me, the antibody test seems to be the only true way to ever indicate what the spread of this truly was.
Right. Those are prevalence, like community-based prevalence studies, which there has been a new study launched here in the Seattle area. It's called the SCAN study. And they are basically trying to do that. But they are, as you can imagine, everyone wants to know whether they've had it.
Yeah.
So I think they can only do a few hundred, 300 or 400 tests a day. But you can go to the SCAN website and look up and try to get into it. And they will send you a test kit to do at home.
Within about 6 hours, I put it up on my Facebook page so people could see. I tried to sign up for it and they were not interested in my nasal swab, but one of my friends' husbands did qualify and he had a kit delivered to him within, I think, 6 hours.
Yeah, there's also the Seattle flu study is maybe another way to participate in that. That's a study that was started with a similar approach. Actually, the SCAN study is a spinoff from the Seattle flu study, which also has the household collect samples both at baseline. Like when you first get the test kit, you provide a sample when you don't have symptoms. And then if you get symptoms later, then they send you another one to start collecting samples. So, and they have added a clause to say, like, you may be tested for coronavirus as part of that now.
Well, and I think mentally, I don't know about you, but my allergies have been crazy because this is also the time of year that happens. And so I vacillate hourly with whether or not I think I have COVID-19. Like, oh my God, I'm sniffling. Oh my God, my chest feels a little tight. Like you're like, no, I just walked by a laurel tree. So I think mentally it would be nice to know if you'd had it or not, for sure.
Right. You know, there are other causes of disease. There's other viruses. You know, there are other causes of human illness and human symptoms that are not related to coronavirus, but it's natural for people to begin to think, like, is this the beginning? I think most of us know at least one person in our own lives who has felt this way or thought about that. That's going to continue as the seasonal allergies kick in. One of my colleagues mentioned that she has allergies and was afraid about going outside and sneezing because people would fear that she had coronavirus, even though she knows that she has seasonal allergies. So it's something that we will continue to face.
For sure. I mean, I almost want to make a t-shirt to just say it's allergies. It's allergies. I promise. Do you know if people are getting it twice? I think that's a question I've gotten a lot too. Are people contracting this 2 times, or is there an immunity piece of it? Or does anyone know?
I don't know that we definitively know. I think based on what we know from other viral infections that the likelihood of that is low. The virus is mutating as viruses do, but the rate that it's mutating is not very rapid. And that means that I've seen people who are following like the strains. There's a group called Next Strain that's following the different strains of coronavirus. And they have projected that based on the mutation rate, that the vaccine candidates that we are producing now are likely to still be relevant, in a year, because that's a concern. If the virus were to mutate too much, that you wouldn't have as much coverage. I think that same logic can apply to immunity. So if you're infected with a strain today, that a strain that you might be exposed to in the future within the next year is likely to be similar enough that your body would process that as if it were the same strain and that you would have immunity. But
interesting.
Until we have more data, I don't know that we will know that 100%. Again, what we know about this virus is largely projected based on the vast body of wealth and experience in virology and immunology from other viruses.
So I didn't realize, because I have gotten this question also, is, we're all curious about what happens if it mutates in the fall. But you're saying, just to clarify, that even if it does, a potential vaccine still might work.
Yeah, it's already mutating. I mean, it's just not mutating enough to make the response necessarily, it wouldn't require a different type of immune response. So your body would see that specific virus as similar enough and you would have immunity against it.
That's actually really reassuring.
That may wane over time. So that's the other thing, is we don't know for example, with measles, if you get a measles vaccine for your 1-year-old, you're asked to come back and have your child immunized again between the ages of 4 and 6, I think is current guidance, because some of that immunity may wane and you may need a booster to help your immune system produce antibodies faster if it was faced with seeing measles again. And that waning immunity concept may apply where, you might need to get a booster, or if you were to see the virus again in a year, whether you would have immunity to it, we don't know. It could operate more like measles, where you might have good protection, but maybe a booster would help you have higher levels of protection. Or you might have lifelong immunity. You might never need a booster. We don't know how robust our antibody response would be if we were to see the virus again.
That is really, really interesting. So I have another question. This is it's just more of a conversation because I think we're all starting to read so much about the science and so much is coming out. But what I am curious about that I don't think anybody knows is the very real psychological toll that this takes on a population. And I think that brings me to kind of circling back to the beginning of how communication is being pushed out to the public. And I think Governor Inslee saying this may extend past 2 weeks is a great example. And I'm glad this happened before we chatted, because I feel like we brace ourselves for 2 weeks. And then you hear a press conference on Friday that says, okay, I'm going to say something on Monday that might extend this out. I feel like that type of communication can almost cause more hysteria. And I'm wondering if that's a piece of what public health talks about before they communicate information. Is the public's response a piece of decision-making and how these announcements are communicated?
So I think that you're highlighting what I also have observed of kind of a gap in communication. And there have been many people in the last week or two talking about the absence of national leadership coming from the Centers for Disease Control. We do have, our spokesman from NIH, who's really our national presence of information and has been the predominant voice that we have been hearing. And that locally filters down to messaging from our own community, which both is communicating what, our national messaging, as well as context and specific messaging for our own community. And that I think because the public health infrastructure, is just limited. There are only so many people, and they have to prioritize what is most essential, what they have bandwidth and capacity for. And that I think I really respect all of the guidance. I cite the King County guidance. I publicize it because I think it is actually some of the best that I have seen available. But there's still gaps. And I think what I see as the biggest gap is the practical application of some of these guidance measures. What is safe to do, what's not safe to do. And everyone has their own, what if scenario. And that, to me, that's problematic because people are then faced with not knowing whether they're following the rules. A lot of people are rule followers. They want to do what's best, but they don't really know what's best. And I think, from a centralized information dissemination platform, it's easier to just stick with the simple messaging of social distance, wash your hands, don't go anywhere when you're sick, limit all activity that you possibly can. But the reality is that I think that puts individuals and families in these positions to determine what's essential. I need some things from the grocery store. Should I really not try to go for 2 weeks because that's the right thing to do? And you can almost become paralyzed in the fear of trying to follow the guidance. Or,
I see that. I see that happening with families even that I know, and even with myself. I mean, I'll use an example, and this is kind of putting myself out there, but I took my kids, they wanted to ride their bikes and their scooter, and our neighborhood is not conducive. So we usually have to go somewhere else. And our elementary school is closed, obviously. And I drove the kids down to the Burt Gilman Trail. It was so packed that I decided not to get out of the car, and I made the turn into University Village.
Mm-hmm.
There was no one at University Village. And so I thought, all right, well, I guess we'll just get out of the car. And they ended up doing about an hour's worth of laps. And, U Village was a ghost town. We saw maybe 10 people from much farther than 6 feet. But I started to feel really guilty. And I started to feel, like you said, a little bit scared, like I was doing the wrong thing. And I felt so unsure. And I'm not used to feeling unsure about the decisions that I make for my family.
Yeah, I can relate. I mean, I obviously I've been following this quite closely. Again, I'm not an expert. Many things I'm saying are my own opinions or my own interpretation of the guidance, but I too have struggled, and I've even talked to my own colleagues and friends. Some of them are infectious disease epidemiologists, to talk about how they're interpreting the guidance and to kind of do a check-in, like, am I interpreting this right, about what you can do, what you shouldn't do? And I think that when you hear the guidance, like, it's okay, it's safe to go for a walk, but then the guidance is make sure you can stay 6 feet away from someone. Well, what if sometimes you can't, but most of the time you can? Is that okay? And, again, everyone is sort of left with their own guidance. And when everything is shutting down, there are just fewer places to go. So you almost need guidance to say, like, these are places that we feel like are safe. Or there's one city who I saw, I want to say it's a European city, but maybe it's New York, where they started closing down streets. And I was like, this is genius. This is what we need. We need large spaces where people can actually safely do social distancing for, like, mimic a trail system with closed down streets. We already have less traffic. Take streets that have 4 lanes of traffic, shut them down, and let people use that so that they can get outside,
Right.
and so they can feel like they're doing things safely, instead of, trying to go to the Burke Gilman, which is technically open, or Green Lake, or wherever your local park is that has a trail system. But what happens when that trail system is overloaded? And, maybe the answer is, like, just shut down all the trails, and then you have to use your neighborhood sidewalks. And that's just hard with, like, kids and scooters and bikes. And, people are just starting to talk about the impact on our children, and we want them to get out. Everyone agrees that it's a good idea to get fresh air. We need to get exercise. It's good for our health to be out in the natural environment, but with just limited options on where to go. And for a short period of time, we can all do that, right? We can all stay inside. I mean, in January in Seattle, maybe many of us aren't getting outside anyway. We do know how to do this, but for the longer it goes on, the sustainability of that is a concern. And I do wonder about people starting to feel more lax about it. I guess thinking about saying, like, what's okay and whether you can, quote, cheat. Well, like, well, what if I just let someone come over to do this one thing, this one time? Is that okay? And that the longer this goes on, it might encourage people to cheat more. So the message, I think, is supposed to be, like, hit it now, hit it hard, like, everybody follow the guidance for as long as possible. But also, like, if we had better guidance on, like, the practical communication about what's safe, and going through very common scenarios of what individuals are facing with their groceries, what individuals are facing with, their takeout containers, taking their kids to parks, using a trail system. I have heard this many times. I have faced these same things of what, I feel like is appropriate and safe. So I really think that we could use better guidance on that.
And I guess we talk about the curve of hospital beds, of respirators, but what I personally am very curious about is the curve of human tolerance for being isolated, and at what point that tide will turn, because I do wonder how comfortable people are going to be after another 2 weeks not working and not seeing people. And I think we can all say, like, yes, right now we understand this is for the betterment. Is this a part of any of that modeling, the psychological aspect of it, or are we not even thinking in those terms yet?
Oh, I think people are already thinking in those terms. I don't know that any of our policies are reflective of that, because, what should we do about it is not the most pressing issue. But, I think, especially I've noticed with the communication from the public schools, the priorities, the top 2 things that they talk about are food access is one of the predominant ones. And, and childcare. Food and childcare are the two most prominent things. And there was an editorial in the Seattle Times a few days ago from a Harborview infectious disease physician who's saying he and his wife are both, healthcare providers. How are they supposed to do this homeschool thing? They are supportive of public schools, but to be honest, the public school system here has not really stepped up to the plate to provide a lot of continuity, and it's due to equity, but they need more creative out of the box thinking. Like lots of schools have computers. Why can't there be a matching program to get people with, iPads or computers that they could take home for those who need it? And just even getting the parents up to speed on the parental controls and the access of all these devices. And no one talks about that you may have multiple kids. What if you have 4 children? Does
Right.
everyone have 4 extra iPads or computers laying around? So you have to be
No.
creative in how
No,
you're
they
doing
don't.
this. And I don't know that we have really thought about one from an educational perspective, what does this look like, other than I think because we are all in a similar boat that, what used to be grade curriculum may have kind of a regressive approach to what they start their school year in. And, what are the long-term implications of that? I don't know. But I will say that at least everyone's in it together, and that you can expect that no one is going to be, perfectly implementing everything. And that in some places, like in Arizona, they don't have that long left to have school. So, letting this sort of wither out in the summer and losing a few months of school may not be the worst thing. But I think a lot of the other issues like food security and other problems in environments that could be exacerbated by the epidemic, child abuse. There are a lot of mental illness. There are a lot of things that are going to be fallouts from this. I don't know how we're going to address those.
That's what I think about too. In terms of my own family, I do, we're going to be okay. It's not great, but we're going to be okay. And our school, because my kids go to private school, we are being supported in a completely different way. So, I have privilege that I will check at that point. But what I cannot stop thinking about is the kids who have to go home to unsafe environments, whether that's abuse, whether that's hunger, whether, 2 parents who don't have jobs now.
Well, yeah, in addition, that the social distancing adds one more layer of people who do actually have supportive communities, families, friends, neighbors that pitch in to help people who are struggling with a mental illness, struggling with a parent who has chronic conditions,
Yes.
who lives in a unstable, unsafe environment, that all of those outlets that are usually trying to build our community up and provide support to individuals and families and communities, the social distancing eliminates that. So then you're faced with this added pressure of, not having a job or working from home, providing education for your kids, cooking them meals, and with no support to do any of the things that we rely on from our service community members, people who are offering services to their communities, as well as our social support networks. You're really faced without that. And you have to get creative. Maybe you need to call up grandma and have them talk to your kid for an hour. There are lots of ways you can try. And I think, we can really focus on the negatives, and I worry about the negatives too. However, because we are inundated with the negatives already, I'm trying to just shift my framework to think about all of the things that we're able to do uniquely during this time, and that there will be some positive things that will come about from this experience, including getting to know our children better, spending more time with our families, maybe reflecting on what's really important in our lives. Maybe this will help Seattle unfreeze a little bit because we'll appreciate actually having social connection. I mean, again, this isn't to say that we shouldn't also worry about those consequences, but sometimes I think you have to kind of shift your framework to survive. And, lots of people have survived worse than we have. As I'm sure you've seen the social media talking about how this is not like World War II. We're not Anne Frank hiding in an attic. It's pretty cushy for a lot of people, but it's definitely not cushy for others. And so, we'll have to try to be as supportive of those communities, when we can find a way to reach them. And hopefully our safety nets of our government can help those who need it. And I think they're trying to think about, the access to technology, and, they've been, I think, doing a good job of doing the best they can with the childcare, trying to find ways to support healthcare workers or other essential members of our community to support them. But it's not perfect. And it also might mean you might not need to judge the neighbor who's got 2 kids at her house instead of just their own, because maybe they're supporting, some family for whatever reason that needs it. And if that's what you need, then, that's what you need to do. You just want to limit that social network to be as small as necessary to be essential.
That is a really good perspective. And I have seen people get so unbelievably creative with their kids. And I would say people's sense of humor has really come out in an incredible way also at this time. So, I mean, I was dying on Twitter last night laughing at what people have come up with. And so there are some good things. In fact, my son was asking me what the impact of this was going to be. Like, Mom, how are we going to come out of this? And I said, Luke, I don't know. But I feel like there are going to be good things that come out of this. Like, just as you said, we're going to start to really appreciate our neighbors more. Maybe we don't do so many activities after this. Maybe we do kind of figure out how we spend more time as a family. All of that kind of stuff will be interesting to see what the aftermath is, really realizing that we can survive on less. Mm-hmm. And maybe we need more friendships. Certainly, it will force me to try every wine I've bought. That's really what it's doing for me. It's really making my palate more sophisticated.
Yeah, it might be an opportunity to get your kids more involved in cooking. And I totally understand, we just kind of need to relax and maybe have a drink at the end of the day. It also can be worrisome for those who are using that as a coping mechanism.
Absolutely.
For the stressful time. So, we can jest about it, but that's always the concern with the social media almost also can play into that's a good strategy, which, can be used in moderation just fine. But I'm sure there are others who are really finding that it's difficult to cope without it. And that's also not a good message.
That's true. Well, Alison, I appreciate you taking time to give us a practical education. And I think like everything else, this is like a super crisis that we're all living through and writing history as we're going. But I think your approach of saying, every family needs to do what they need to do. And as long as you're interpreting the guidance in the right way for your own comfort level and your own anxiety levels, then go with that. As long as it's within the realm of what public health is telling us.
Exactly.
Well, I appreciate your time and your expertise. I feel like this is the one thing you and I can do to actually help is put out real information and be vulnerable as people in saying that this is not an easy time for anyone.
We will just do the best we can, but we will all get through this. It will end.
The truth is that Alison and I spoke for almost an hour after this interview, not as interviewer expert, but as two women who are trying to muddle through an incredibly muddy time in life. Trying to do the best we can for our kids and trying to figure out how to laugh and support each other. And that's what I'm trying to take away from this whole experience, trying to find what I can laugh at. My kids have handled the new reality incredibly well. I think if the quarantine has shown me anything, it's that I'm pretty sure my son never needs to leave our house again. It's also that the art supplies and little projects I bought the day school closed have been more important than toilet paper in my house. Keep that toilet paper, man. As long as we've got paint and glitter, we're good. I've honestly never felt closer to humanity. This experience has leveled my humility. We have no income coming in right now like millions of other people. And still, my privilege allows me to realize that we'll still be okay at the end of this. I rapid cycle through emotions, happy one second, sad the next, anxious the next, because I know other people won't weather this storm so well. I worry about the kids who don't have a safe place to stay and are hungry. I worry about myself being isolated. It was terrible for my mental health when I had newborns. Turns out it's no better now. Just figuring out how to cope has taken me a couple weeks. And one of the ways I'm coping is that I'm trying my very best to let go of the pressure to be perfect. People are showcasing how talented they are at creating curriculums for their kids and having beautiful art projects ready to go. And I absolutely love seeing what people come up with. I can do that sometimes, but not all the time. Sometimes I need to chuck my kids in the bathtub and do mani-pedis because I have to have fun too. I have to get outside, so we're doing that in the safest way we can, but I need it for my sanity. I've never been more thankful for my own creativity as a mom because we really need it as a family right now. So that's what I'm trying to focus on. Yep, I lose my mind on my kids. I certainly am not my best self at every given moment during the day, but we need to give ourselves and each other a maximum amount of grace and the room to truly know that it's okay to apologize when you screw up. It's good for our kids to see us lose it, then collect it and apologize appropriately. We're human and they can see that. This is a true test of patience and grit. The psychological toll is real. The worry and fear are real. I ultimately know that this will pass, but it will touch us all as it plows through our communities. I'm wishing everyone out there health and sanity. I feel like this is a time in life where we have the freedom to just get through it and try to help as many people as possible along the way. Take care. Continue to try to connect with people and still ask questions because life is still happening right in front of our face.